My name is Zach Ayers, and I am a graduate student in psychology at SUNY Brockport. My academic mentor and I have generated a dream policy, the intent of which is to improve the mental health of college students with a new model. Studies have shown increasing levels of mental health problems among college students. These problems have only been exacerbated since the arrival of the COVID-19 pandemic. College students have faced increasing isolation, loneliness, and a sense of disconnection from their studies, their faculty, and peers. University faculty and staff, in turn, have confronted these challenges with currently available resources in college counseling centers, residential life services, and resident and commuting student programs. Their efforts successfully accomplished COVID related transitions in services in 2020, including incorporation of online media platforms for teaching, support services, and counseling. As notable as these successes are, however, the changes necessitated by the pandemic still followed a traditional model of service delivery, including requiring students to ask for assistance, providing available helping resources largely in specific buildings staffed by professionals, and often requiring a waiting list. Increasing evidence suggests that students are less likely to utilize these resources despite attempts to improve accessibility and convenience. Educators, for example, Strickwerda 2019, have noted the key role which college faculty play in student retention and success, and there has been growing concern over the declining college graduation rate in the United States. Our new DREAM policy aims to mitigate both students' mental health concerns and also decreases in college graduation rates as well. Specifically, our proposal is utilizing graduate psychology students as mental health consultant advisors for undergraduate college students. These graduate advisors would be assigned to specific undergraduate classes and also sports teams. Many graduate psychology students have taken classes in therapy, counseling, and stress management, and have done applied work in the field via practicum courses. This model would allow increased relevant hands-on experience for graduate students and meet the needs of undergrads for accessible, on-site, readily available paraprofessional help in their classes on a regular basis. The graduate consultant advisors would regularly attend undergraduate classes and team meetings for each class and sports team which they have been assigned to. Undergraduate students will get to know their assigned graduate consultant as a resource for information on meeting their wellness needs, as well as managing the workload of classes. The graduate student will play a key role in linkage to care options should students request formal referrals to the counseling center. But the primary work of the consultant will be meeting and guiding their undergraduates both before and after class and also during regularly scheduled office hours, which will be offered both virtually and in person. When needed, the graduate student can also fulfill a tutoring or review role for students as they meet class demands. This higher level of individual attention and direct contact with undergraduate students coming from a graduate peer consultant would likely make the students feel more valued by their universities, as well as give them more readily available opportunities to ask for help with mental health concerns. In addition, this opportunity for psychology graduate students will provide practicum experience and help address existing shortages in field training opportunities. Having been in the position of undergraduate students, we believe that graduate psychology students, especially advanced graduate students with counseling and therapy experience, will be capable of offering social support, sound advice, and essential preventative intervention services on how to navigate the tightrope of being a college student. Thank you. We really appreciate your time and attention.